Well, hello and welcome. This presentation is Medicare and Federal Benefits. My name is David Painter. I am a community liaison with the Ohio Senior Health Insurance Information Program, better known as OSHIP. So we're going to talk, starting out, we're going to talk about FEHB, and what that stands for is Federal Employee Health Benefits. It covers all current and former federal government employees, and they are administered by the Office of Personnel Management, and their website is there, www.opm.gov. So for Federal Employee Health Benefits, FEHB, and Medicare, if a beneficiary is retired and on both FEHB and Medicare, Medicare pays primary and FEHB is secondary. FEHB will pay primary if the beneficiary does not enroll in Medicare Part B. If the beneficiary decides to keep FEHB as a primary, they will not get a special enrollment period to sign up for B later, and they will have that late enrollment penalty. Some beneficiaries choose to stay with FEHB and never enroll in Part B. If they do disenroll from FEHB, they will not be able to get it back in the future. To dive into that just a little bit deeper, we're going to talk about FEHB and delaying Medicare enrollment. So, if a beneficiary receives retiree FEHB, they may decide not to enroll in Medicare Part B when first eligible. This is very common for federal retirees. The retiree FEHB, it will continue to pay as primary. It will continue to pay just like what Medicare B would do, a lot of the same benefits. And some beneficiaries decide that they want to stay with the retiree FEHB and never enroll in Medicare Part B. So generally they're going to have a Medicare Part A and not enroll in the Part B. If a beneficiary wants to have both FEHB and Medicare, they should sign up for Medicare Part B when they are first eligible. Of course, they're going to have to pay the Part B premium in addition to the FEHB premiums to avoid any sort of late enrollment penalty. And again, if the beneficiary delays enrolling in Part B, they will likely face a late enrollment penalty. And as you've probably learned in some of the other segments, it's generally 10% a year tacked on every month for every year you delayed enrollment. If a beneficiary disenrolls from FEHB, once again, they will not be able to get it back in the future. So this is one of those retiree plans that if you decide to disenroll, you can't go back and change your mind and pick it up at a later date. Shifting gears a little bit, let's talk about the military. Military benefits, Tricare. And there's the website there as well as tricare.mil, MIL short for military. Couple different types of Tricare we're going to talk about. The first one is just Tricare, which is military insurance for active duty service members and their family members. We're also going to talk about Tricare for Life. Tricare for Life is coverage for individuals who are retired from the military and have Medicare. So, military benefits, Tricare. Tricare, again, military insurance for active duty service members and family members. There are a number of different Tricare plans. There's a number of different ones you can choose from. Some of these Tricare plans, actually most of these plans, will include prescription drug coverage. Tricare pays primary and Medicare pays secondary for active duty service members and their families. So again, as long as you're still active, if you're still working, or your family member who is in the military and still active, it is going to be like any other current employer insurance. It is going to pay primary and Medicare is going to be secondary. Now, Tricare for Life is once you have retired. So Tricare for Life coverage for individuals who are retired from the military and have Medicare. An individual who is eligible for premium-free Part A must sign up for Medicare A and B. Then Tricare benefits are received for Tricare for Life. So just to reiterate, if once I've retired from the military, to get my Tricare for Life benefits, you do have to enroll in Parts A and B because Medicare is going to pay primary, Tricare is going to pay secondary. It's just going to work as a retiree insurance plan that pays secondary to Medicare. So Medicare is primary, Tricare for Life pays secondary. Tricare for Life may pay some claims that Medicare typically does not cover. One of the most common ones there being care outside of the United States. There's a lot of things that Tricare for Life will cover that Medicare may not. And again, Tricare for Life's drug coverage is considered credible, meaning it meets Medicare's minimum standards. All that means is the drug coverage I have for Tricare for Life is going to count as a Part D plan, and I won't be subject to any sort of, late enrollment penalties because I have Part D. Just my Part D is through Tricare for Life. Tricare for Life and Medicare enrollment. So I'm 65 plus, I should say you're 65 plus and covered by Tricare. Through their or their family's members' active duty can delay enrolling in Medicare Part B and remain eligible for Tricare. This is like any other employer insurance. As long as someone is currently employed and you're covered under either your current employer or your spouse's current employer, in this case, we're talking about the U.S. military, you can delay signing up for your Part B and you will not be penalized. When that ends, when you retire or your spouse retires, whoever that is who's active military, you would have a special enrollment period to enroll in Medicare when your Tricare coverage ends. Now we're talking about your active duty coverage. And the easiest way to think of it is just think of it like any other employer coverage, meaning while I'm working, I don't have to sign up for Part B as long as I'm covered by my current employer or my spouse's current employer. But once I've retired, now I have to sign up for Medicare A and B. Now, individuals 65 plus and not covered through active duty service, meaning I've already retired, you should enroll in A and B right away when you first turn 65, because you risk, if you have that gap, you risk not being able to get that Tricare for Life coverage. So even though it's a military program, it's a federal program, it works very much like any other employer insurance in that while you are working, you don't have to sign up for Medicare Part B. Once you've retired or your spouse retires, whoever that comes from, now it's time to sign up for Part B. If you've retired prior to age 65, when you turn 65, you need to be signed up for A and B so you can get signed up for the Tricare for Life. Still talking about military benefits, but now we're talking about something that covers a whole lot more folks. Veterans Affairs benefits, the VA. So VA benefits are coverage for individuals who are determined to have a disability related to active duty service. Now, I like to expand on that a little bit, the term disability. There are a lot of things that the VA will cover. They just have to somehow relate it back to your service. They have to relate it back to your service. However, they do a wonderful job with that, and there are a lot of folks who use the VA for all sorts of medical conditions. VA benefits do not coordinate with Medicare at all. That's one of those head scratchers that why are the two federal agencies so separate, but they really kind of are. Essentially, folks either get their care through Medicare or they're getting it through the VA. VA benefits cover some benefits not covered by Medicare. Custodial and nursing home care. Custodial care means someone to help you in your home, not necessarily medically speaking, but someone who can help you out there at home, and of course, nursing home care. The VA's drug coverage is considered credible, meaning just like we talked about with Tricare, if you are a veteran, you are using the VA for their prescription coverage, it is considered, it meets Medicare standards, meaning I don't have to go sign up for another Part D plan. And if I do change my mind on down the road, I don't want to use the VA anymore, I want to go ahead and sign up for a Part D plan, would not be subject to any sort of late enrollment penalty because you had credible Part D the whole time. Individuals with VA benefits should enroll in Medicare when first eligible. Okay, it is important to have both. Even if you're just going to sign up for A and B and say, I'm going to use the VA for my medical care, I'm going to use them for my prescriptions, it's still important to have that A and B. And it is worth noting that you will not have a special enrollment period if you delay that. If you delay it, you're not having any sort of special enrollment because you've used the VA. And now we're going to veer off a little bit, sort of talk about some of the other types of insurance that might cover some issues: liability, no fault, and workers' compensation. Now, Medicare actually pays secondary to all these types of insurance. Essentially, it's some other agencies responsible for this. Therefore, Medicare can come in as a secondary, but it's not going to pay as a primary. Medicare can make conditional payments as a primary payer, and an agency called the Benefits Coordinator and Recovery Center can help reimburse Medicare for that. So what are we talking about here? We're talking about liability insurance. This protects the policyholder if they are legally liable for someone else's injury. So, and you see there sort of in the picture, you see the home and sort of that thing. That's sort of what we're talking about. You know, if your homeowner's insurance, for example, if someone gets injured on your property, your homeowner's insurance can help pay for that. No fault. Here we're talking about pays for healthcare services that result from individuals' injuries, regardless of an accident, regardless of fault. For example, you know, the most common one there being an automobile accident. You know, if in an automobile accident, the injuries are usually covered or should be covered by the auto insurance. So it's not going to go directly to something like Medicare. And the last one, and certainly not least, is workers' compensation. These are state administered programs. So each state's a little different with their workers' comp that pays for healthcare claims and job-related injuries. There are, you know, a number of folks who have these, and it can get a little tricky because with workers' comp, they're only going to pay for things directly related to that job-related injury. So Medicare is still going to be in there. It's still important to have that for, you know, the other things that might be going on, you know, high blood pressure, diabetes, whatever it is. The workers' comp is only going to pay for things related to a work-related injury. And last but not least here, we have some resources up there. First one is Medicare.gov. They are, you know, the federal agency that handles all this. You see the 800 Medicare number and also the website. Next one down there, socialsecurity.gov. Their phone number as well and their website. And last but not least, the SHIP network. This is how you reach out to us here at the SHIP programs. We are in every state and U.S. territory, and we're here to help you get some personal assistance, one-on-one counseling, and really help you work out through these issues. If you are looking for individual counseling assistance with your Medicare choices and coverage, please be sure to contact us, your state health insurance assistance program. And here's the website there again to do that. You can find your SHIP, and we are here, you know, to help you out and help you make the smart, educated decisions. So with that, I will thank you for spending a little time with me going through this, and I hope the rest of this program has been wonderful for you. Thank you, and have a good evening.